you.
Yeah.
Okay. So if you are going to be referring to our facilities, though, here's the information. So at university, you call the 720-848-0300 number, and that will take you to the main line for their call center, and they'll help direct you. And then Lutheran has their exact number for our oncology and hematology clinic that you can call. So referrals do not go through us if a patient is diagnosed. That's actually going to be the primary care provider usually makes that referral to that clinic, and that's how it's done. And then, but if you have a patient that has a lot of concerns or needs after they're diagnosed, you can reach out to us directly by phone or email, the one at the beginning of the presentation, because we don't see every patient that's diagnosed when they come through our doors. It's usually staff will refer to us if they hear of a need or if a patient requests something. And so if you did refer a patient to us and you're needing to stay in contact, needing to be updated, anything like that, please email or call us with any questions or concerns you have. Because in the cancer facility, we don't usually keep regular updates. The oncologist will update the primary care provider on treatment plan and things going on, but we don't directly update all the time on patients. So if you have certain concerns, please reach out. The other thing that oncology programs are starting to do, and you may see it in your facilities, is that we're starting on survivorship programs, and that's in the works. It's a transition process for us. It's not perfect, but that's something they're trying to do to help providers when their patients are coming back, when they're done with treatment, how to better provide healthcare for them as a cancer survivor. So that's a work in progress, but by no means is it perfect at this point in time. So, Katie?
Yeah. And then just some general advice to guide patients, especially as they're newly diagnosed. The patient should educate themselves on their diagnosis, and this is to a level that they're comfortable with. So certainly there are some patients that would want, more information, as much as they can get, and some that won't prefer. So whatever they're comfortable with. The patient should write down the questions that they have for the doctor so that they don't forget. And these can be practical questions as well. So it doesn't necessarily have to be, only medical focused. Understanding what their insurance will cover and won't cover. Know who your supportive care team is, if you have one, and how they can help you. So whether or not you have a social worker assigned to you, a dietitian, a nurse navigator, a patient navigator, psychologist, financial counselors, etc. And in knowing that, also inquiring, what services may be covered by insurance, what are provided freely to patients, and things like that. The patient is the decision maker and not the doctor, so treatment should be based on what's important to the patient. The patient needs to have a good relationship with their treatment team. They need to trust them, and just that they should understand that if they, aren't feeling comfortable with their treatment team, that it is okay to get a second opinion as they're, moving through this and making decisions about what their treatment options are and what they want to do. And don't be afraid to ask for help from family, friends, and the community. The patient should tell them what they need, and that's okay.
All right, and so we at the American Cancer Society actually have a lot of booklets, materials, especially on the website, information for newly diagnosed patients. So I just wanted to go over this a little bit. Cancer Basics just talks about what cancer is, information about who your team would be, things like that. Very basic. A lot of these booklets and things are like 5th grade to middle school reading level, so easy to understand. They're also in multiple languages, English, Spanish. I believe we have some in Chinese as well. So don't, and they can change the language on the website as well if they go to the website. The after diagnosis booklet is great for patients because it kind of goes overall their whole plan of everything. Understanding your diagnosis is quite broad and has different sections on that piece. And then the doctor-patient relationship, this is a good one for patients just to understand who their team is, what their roles are, and how the relationship should be with the patient, and having the patient understand that they're the focus, so they get to decide what happens and can't be pushed into any treatment plan that they don't want. Telling others about your cancer. This comes up a lot. A lot of patients struggle with letting family, friends know when they have cancer, and then it's really hard, especially if they start treatment and they're having physical side effects like hair loss or things, and they can't really hide that anymore. So a lot of people are unsure how to do it. So this is a great way to help your patients with that. Coping with cancer, that will talk a lot about the emotional distress and emotions you're having, anxiety, anger, sadness, unsure what to do. That's a great booklet to go through with patients. Treatment and side effects, you can dig in deeper depending on what their treatment plan is and what side effects, because it varies quite differently. So that's great for patients to understand, and helping them understand they may not get everything anyway. And then finding and paying for your treatment. Some patients aren't sure where to go for treatment, or especially if they are uninsured or here illegally, things like that. They're a bit more limited. And then also paying for treatment, and that could be different if you don't have insurance or you're on Medicaid or private or Medicare. It ranges, especially on the facility you go to. So that's a good breakdown to start with. And then this caregiver and family support site is also very helpful, because a lot of times caregivers just aren't sure what to do or how to react. And so they have a lot of resources for caregivers as well. Now we have these on the website and then also in booklet form. If your hospital is or center has an account with the American Cancer Society, we have hospital system managers that can order materials for you. If you don't, you can usually call the 800 number and they can walk you through that. But the hospital system manager told me they may just be directed back to the state. So we're going to find out the exact way if you want to order materials for patients. We also have screening materials and prevention materials as well. So I will have Amy send out the list of what we have available and then how to order that for your facilities if you would like.
And then we wanted to list a resource for primary care providers. And again, we have hyperlinks on here so that you guys are able to kind of click out to this e-learning series as well as the other resources that we've listed. But there's a cancer survivorship e-learning series for primary care providers. The listing of the different modules are here, and the hyperlink, as I said, is there that you can click on in order to go through them. Module 1 would be the current state of survivorship care and role of primary care providers. Module 2 is the late effects of cancer and its treatments, managing comorbidities, or coordinating with specialty providers. Module 3 is late effects of cancer and its treatments, meeting the psychosocial healthcare needs of survivors. Module 4, the importance of prevention in cancer survivorship and empowering survivors to live well. Module 5, a team approach, survivorship care coordination. Module 6, cancer recovery and rehabilitation. Module 7, spotlight on prostate cancer survivorship, clinical follow-up care guidelines for primary care providers. Module 8, spotlight on colorectal cancer survivorship, a clinical follow-up care guideline for primary care providers. Module 9, a spotlight on breast cancer survivorship, clinical follow-up care guideline for primary care providers. And Module 10, spotlight on head and neck cancer survivorship, a clinical follow-up care guideline for primary care providers.
And I just want to add an extra note on this. This is free. for primary care providers, and you don't have to be the doctor behind that. If you are a navigator, nurse, whatnot, you can go through this too. All you do is you click on that link. You have to create an account, and then they have a little code you can enter to go through this. So this is quite helpful for individuals just understanding how to relate and how to care for patients who have had cancer. And then so just some general cancer information or support websites you can give to your patients that are just starting out. The American Cancer Society is always a great one. National Cancer Institute as well. So that's our government's website. Cancer.net, which is the American Society of Clinical Oncology. They're wonderful. Cancer Care, they're a great resource for support, emotional support, financial support, information in general. They're kind of overall. Cancer Support Community and is more of a website that a patient can be involved in their own care, tracking different things, connecting with other survivors, getting more information, also allowing other people to be on the journey with them, like family and caregivers who may not be in the same state or town. And then Springboard Beyond Cancer, which is a survivorship webpage that cancer.gov did. That's really great to kind of track everything that's been going on, so you have it all in one place.
And then we wanted to put some searchable database for services and assistance. And, you know, these are all of them pretty comprehensive in the information that they're going to have and provide. The number of things that come up obviously are going to vary. Some people might have practical needs. Some people might be interested in what, you know, scholarships are out there. Some people might be interested in financial assistance or transportation. So we've tried to include these databases for services so that it can, you know, be an easy place for them or for, you know, whoever's helping them to look up some of the things that they might be needing. So we put 211 Colorado, which is going to be a good database, obviously for Colorado specific, and it doesn't have to be certainly cancer related on that. So certainly a lot of people go on to look up what services or organizations or support there might be in their area for, you know, multiple different types of needs. The National Cancer Institute has a searchable database for support and resources. The Patient Advocate Foundation, they have the National Financial Resource Directory. And then on Cancer Care, it's listed, it's the Helping Hands Resource Search. And so again, on these, you really can kind of tailor the search to everything from using a zip code, using the cancer diagnosis, and then also clicking on the boxes or the topics that you're looking for information, and it'll do sort of a tailored search for whatever that person or what you're looking for.
Katie, are we good on the chat with questions?
We are, except I have to keep closing it
Oh, okay.
to see the screen, but yeah, we're good.
All right, and then transportation is always a pretty big need for patients that are diagnosed, and it can be a bit limited in rural areas, unfortunately. So we kind of try to patchwork things. So of course, not every extensive transportation resources is on here, but it's some main ones. Dr. Mack, the Denver Regional Mobility and Access Council, actually has a Getting There guide, and it covers, I believe, the 5 or 6 surrounding counties to Denver Metro, and what transportation resources can be available, and those can be free services. Some are paid services as well, so they are a great starting point if you have patients in the Denver metro area needing help with assistance. VAO, so Medicaid transportation, and this depends on the counties, what's available. So I would check with your county, but they do have where they can pick up patients for appointments that have Medicaid, and then also they have mileage reimbursement, and that can just depend on the county. And how that will work is your clinic or the oncology office where that patient is going needs to fill out a certification form for that, turn it in to start those rides for that patient. But some of your patients may already be using that anyway, so they can continue with their treatments depending on where they're getting treatment. National Patient Travel Center is a great hub for searching what's available. You can give that patient that website or that phone number, and they can tell them what their needs are, and they will look and see what's available for them. Angel Flight West, Footprints in the Sky, and Corporate Angel Network, they're actually for plane travel. And so this is usually more so for patients traveling outside of the state, especially if they're doing a clinical trial or something like that, or their treatment option isn't available in the state they live in. However, this could also be if you're having a patient come from like Durango to Denver for appointments. They also do flights like that as well. So that can depend on where they're going.
And then we listed some lodging resources. So, if you have patients that would be traveling to get their treatments, there might be hotel assistance. There are some locations that are going to have, an actual house or, kind of patient housing that they provide. So we did want to list some of these out. Joe's House, which is the first one listed, is this actual searchable database for cancer patients to locate hotels near a treatment facility. Certainly it's going to list sort of the larger cancer treatment facilities in the states, but they can go on the site and put in the state. So assuming that it's Colorado, they would put Colorado in, but they can search other states as well if they're traveling. And then you can actually pick the treatment location, and it'll generate a list. And that list will have places that might have, say, shuttles to and from. It'll list the distance, whether or not there's a medical rate discount and things like that. So it is a database that you can actually search. Healthcare Hospitality Network. We've listed the Fisher House for VA patients here in Aurora. Brent's Place, which is pediatric and bone marrow transplant in Denver Metro. Ronald McDonald House, which would be pediatric, Denver Metro. John Zay Guest House, Penrose, St. Francis, Colorado Springs. The Thomas House, which is UC Health Memorial Hospital Central in Colorado Springs. Rose Hill Hospitality House, St. Mary's Grand Junction. And then NCMC Hospitality House in Northern Colorado Medical Center in Greeley.
And then, so we all know that housing is still an issue in Colorado, and unfortunately we don't have a perfect fix for that, especially when a patient's diagnosed with cancer. That doesn't mean we can just absolutely find them housing either. So our main resources, we do go to the Colorado Housing Connects. They are based for the whole state, and they actually have housing navigators, and so they can help find housing, but they can also help with housing issues, like if they're having troubles with their landlords or evictions or trouble with mortgage or things like that. They kind of encompass all housing issues, so they are a great starting point. And then, of course, we can always also reach out to the local county housing authorities and see what programs they have available. But unfortunately, a lot of them do have over 1 year waiting lists. I know in Denver, that's a big issue we have in all of our counties. So, but those are the main resources we use for that.
And then obviously we know financial assistance needs might be a very big concern for people, especially as they're moving into treatment or as they move through treatment. So these are just some general financial assistance resources. There are some that are going to be Colorado specific, and then some that would be, national or links to sort of national organizations that might provide some assistance. A lot of the financial assistance resources that would be available would have some eligibility requirements, and that would be based on income. However, there are some assistance that might apply based on someone's cancer type or diagnosis. Some may apply, there's assistance for particular needs, and maybe it's women who are in active treatment or someone with a particular diagnosis. So it's always worth searching, even if they may not meet eligibility requirements. But these are kind of the few that would be common places to start. So Ray of Hope and Rocky Mountain Cancer Assistance, RMCA, they actually utilize one kind of grant application for the two of them. Friends of Man is another here in Colorado. James L. Kint, Cancer Care, and then the Cancer Financial Assistance Coalition. And the Cancer Financial Assistance Coalition is a searchable database. So, you can kind of search based on what the need may be. So, yeah.
And like Katie said, this is just a small list. We do have many more that are specific to cancer types. or eligibility or things like that. So if you do have a patient that's needing quite a bit, please just reach out and ask. Also, a lot of times social workers, where that patient is going, will probably know of resources as well to that area. But please just reach out if you have any patients with assistance. And then also sometimes we come across medication assistance that's needed for patients that it's just costing too much. And so all of these, HealthWell Foundation, Patient Access Network Foundation, Chronic Disease Fund, Patient Advocate Foundation, and Gentech, they all are always changing what diagnoses they cover. And so it can be cancer related, but it can be non-cancer related as well. And so we will help patients find what they're needing on this. If they have a certain medication that they need help covering, especially if the copay costs a lot, patients can have insurance and Medicare on this, usually not Medicaid, because most of their prescriptions are covered where they have a copay of just a couple dollars. But also we'll do applications for specific pharmaceutical companies as well beyond just this to get on their financial aid program for patients to cover. So this can also be a way to help eliminate financial distress for patients. They have a lot of medications. And I've also done this for if a patient has cancer but they have another disease that they need medicine for, I'll help them apply for that other medicine to help lower the cost in general.
And then if there's any insurance or kind of access to care needs, we've listed, again, just a few. You're probably all pretty well versed in some of just the main, Medicare.gov and other things like that for insurance. But we wanted to list out Benefits in Action. This is a local organization, and I know, help patients. They can assign a navigator, but they also have helped patients with application assistance. So, we've had patients here at University Hospital that have been inpatient, and they actually will send someone out on site to go through the application with them. So that may be needed for, people as they move through with insurance or kind of access to care needs. And then Patient Advocate Foundation as well, we wanted to list.
Yeah, and you can always have your patient check where they're getting treatment to see if they have a financial counselor. I know both Katie's and my systems do, where they will meet with the patient in the beginning and go over their insurance, what benefits they have, walk them through it, and then also see if they're eligible for anything else, different insurance, Medicaid, Medicare, and also they'll do prescription or drug applications and things like that. So there are a few resources that way. And then employment resources. So this is great if you have a patient that's working and then they're really worried about their job. Now that they have cancer, what is treatment going to look like? Are they going to lose their job? How do they keep that? FMLA questions, things like that. Cancer Care is a great resource in that sense. They cover all of that. And then also if you're looking for a new job and you have a cancer diagnosis, how to do that. So resumes, all types of things. And Triage Cancer also covers those bases as well, kind of same program, but they also cover a few other things as well as insurance questions, legal things, whatnot.
And then moving into legal resources, the Cancer Legal Resource Center is a wonderful organization and does provide a lot of information, whether someone calls in or certainly on their website. There is a patient handbook that they've created as well that they will mail out. So if you're interested at all for having those to hand out or know of any facilities, you can go on their site and get those as well. The Colorado Legal Services in particular would cover obviously Colorado specific kind of laws and things like that, but also help people if they're looking for actual legal assistance in the state of Colorado. And there would be link outs as well to, some pro bono or low cost attorney searches and things like that. So it's not only helpful in terms of the topics that it covers and is very informative there, but also if people are actually looking for legal counsel, it's a good place for people to start.
All right, and then some psychosocial resources just for after a patient's been diagnosed. Cancer Care has counseling through social workers that you can call by online or call, and then they also have online and phone support groups that are specific. So that can be helpful for patients who live in rural areas that may not have a local hospital or cancer center that has social workers, psychologists, or local support groups. So that's another resource patients can look into. If you're at a local hospital, the social workers and psychologists can only usually meet with the patients that are receiving care there. However, most support groups are open to the community, so a patient does not need to be receiving care to go to their support group. Immerman Angels and Fourth Angel are one-on-one mentoring programs for patients and caregivers, so they will match individuals up with trying to do same type of cancer, same type of treatment type, family dynamics, things like that, if people have kids or single parents, something like that, divorced. So sometimes that's nice for patients to help understand their treatment plans, or if they have questions and aren't sure, talking to someone that's gone through it is very helpful. Also in the Denver metro area, DU has a program. It's called Center for Oncology Psychology Excellence. So this is where individuals can get counseling for their cancer diagnosis. So it's usually through a doctoral student that they're providing for, and they have a sliding scale can help if a patient can't afford that.
And then for clinical trial resources, certainly for a lot of patients, the conversation will come up when they're talking to their oncologist or hematologist and provider about what might be available at that particular treatment facility. If people are wanting general information about clinical trials and understanding kind of, what that means and how they work and things like that, as well as being able to search, these are just a few resources that I've used and I know Ashley's used that we find helpful. In the National Institute of Health, NIH, they have a searchable database for clinical trials, and you can search, open, closed, you can search by location, obviously by, cancer type, things like that. ACT, which is about clinical trials. Clinical trials, what you need to know, which is on ACS's page, so cancer.org. And kind of some of the topics that would be covered under that clinical trials, what you need to know, are the basics of clinical trials. What are the phases of clinical trials? Making a decision about it. How are clinical trial participants protected? How do I find a clinical trial that's right for me? And what is it like to be in a clinical trial?
And to go off that, most facilities that offer clinical trials also on their website tell about what clinical trials they have, so they have a searchable database, and they also have the clinical coordinators and things like that, so usually have their information that patients can call to get for more information, because it is just based on eligibility, based on staging, what they've taken, like what treatments they've done, quite a bit. So not every clinical trial is right for every patient, and it's not usually the first go-to treatment for a patient. We will be, yes, Amy is going to be sending out all of this for you. And then our most resources available in other languages. So most of these resources are at least available in Spanish, a lot in Chinese as well. I'm going to get a little further for you, Lupe, to answer that other question about a call-in center that has that availability.
Well, and if they call into the American Cancer Society number, they would have interpreters available for, I don't know at last count how many languages, but that would be a possibility for people wanting to call in to get some assistance. So
yes, I was going to cover that, Katie. Yeah, you beat me to it. So now just specifically going in resources we have available with the American Cancer Society, how we're helping patients besides just our job. Road to Recovery provides free rides to patients for oncology-related appointments, and that varies a little bit on the area. So listed below, we help in Denver metro area, Larimer County, so basically Fort Collins and Loveland, bigger areas, Sterling, In Logan County, Weld County, it's more Greeley, Windsor, but for some further towns out, we may have like Kersey, whatnot, Grand Junction, Colorado Springs, Pueblo, and Durango. So the Road to Recovery is usually volunteers that will provide free rides to patients. Colorado Springs, they also have a taxi program that they can help. And then in Pueblo, they also have the taxi program, and they give out gas cards if a patient is at St. Mary Corwin. And then the hotel lodging program we have in Colorado. So this provides free or discounted hotel lodging for patients while in treatment. So we have that available in Durango, Colorado Springs, Grand Junction, Greeley, Loveland, Pueblo, and Denver Metro. And now, Katie, I'll let you talk about
Perfect.
the 800 number. It's right there for you.
Yeah. So, again, just sort of more American Cancer Society resources. Hope Lodge. So it's a free place to stay that provides a nurturing home-like environment where guests can retreat to private rooms or connect with others. In our particular area, we don't have a Hope Lodge, but it may be that some of your patients would be going for treatment in locations where they would. So we wanted to mention that. Reach to Recovery, which matches breast cancer patients with trained volunteers who have a similar diagnosis and treatment plan to provide more personal one-on-one support. The WIGs, so there are TLC, which TLC is American Cancer Society catalog, and then also webpage that would have things like wigs and hats and headscarves, mastectomy products, prosthesis, and things like that. But specifically for the wigs, the TLC certificates, which is like a voucher for $70, and it would be available to cancer patients. There's also free wigs available at Lutheran, which is where Ashley is based, and then at University Hospital here where I'm based. And with that, and I believe it's the same for Ashley, but we would just schedule an appointment to do a wig fitting. And if they find something in the selection we have on hand, we would provide one free wig or the $70 voucher for every 12-month period that someone's in active treatment. So, again, if someone is wanting to look at wigs and, see what we have on hand, they can certainly call Ashley or myself if they're going to be available to come to our locations, and we can see about doing wig fittings. And they can also ask at their treatment facility if they have any sort of wig program. But the alternative would be providing that $70 voucher available to cancer patients that they then can apply towards a wig out of the TLC catalog. And then lastly, what we had mentioned before, but the ACS National Cancer Information Center, it offers help as you're dealing with cancer by connecting you to caring, trained staff to answer questions about diagnosis, identify resources, provide listening ear and guidance. It's open 24 hours a day, 7 days a week, 365 days a year. We've listed the phone number. It's 1-800-227-2345. And again, they can call, at any time. There would be interpreters available. So if English is not someone's first language or spoken language, that would be available to help them. But they will provide, information on their disease, resources, can just talk to them about kind of their diagnosis and what they're going through. And so it's a great number just for patients to have when they have questions as well.
And to add that, Katie, I believe it's over 200 languages.
Okay.
They have interpreters too. And you can also ask patients if they have clinical questions or like insurance questions. They have insurance specialists, and they also have like oncology nurses on staff to answer questions and things like that, clinically based. So, and then, so that's, my end of my slide. And to answer, I think, so resources can apply to Medicaid patients, but also self-pay patients, patients with private insurance, Medicare. A lot of these resources are available to any type of patient. So I have had where it comes up with financial grants. If you have a patient that is here illegally, it is a little bit harder because they do need to have an ID, and they request that they have residency in Colorado State. So that could be an issue in that case. So if we have illegal patients, some resources are a little bit harder. So any other questions people have? We're now done, so please ask away if you have anything else. But like we said, Amy's going to be sending out the slide for all of this information so you can have on hand. And then you can always reach out to us if you have any questions. We have people that do that all the time. Sometimes they just need to brainstorm to find some resources for a situation, but they may not refer the patient. They just need some resources available. But you can refer patients even though they do not go to our facility for treatment. I more so than Katie, because she just has a larger load of patients for her facility, but I absolutely help patients outside of Lutheran Medical Center.
Great. Thank you so much, ladies. We really appreciate you having taken the time and sharing all of this with everyone. You can, of course, continue to type a question if you have one, or reach out to Katie or Ashley. I did put in the pre-post test link. I also went ahead and just kind of smushed everything together there. So if you could please take a few minutes. It's real short and sweet. To just go over what you think about today's presentation. That would be much appreciated. And of course, feel free to reach out to me with any questions, and I will have everything sent out to you guys soon. Oh, there's one more question from Lupe, ladies, about the modules.
I believe so, Lupe. I believe with that link, all you have to do is set up an account, and then it will give you a code to type in, and then you just put that in it. Then the module should be available to you, because I've gone into them and I'm not a doctor, and it let me go through everything. So I believe that should be available to anyone.
Yeah.
Okay, no worries. Oh, okay. All right.
All right.
All right.
So any last questions? We'll get things wrapped up here.
And certainly if there's more questions, I know myself and Ashley, you can certainly email us or call us, if you want more information on something or have questions.
All right, great. Well, thank you everyone for joining, and thank you again, Katie and Ashley. We really appreciate you. And if anything else, just reach out to me. Otherwise, have a wonderful day, everyone.
Great. Thank you so much.
Thank you.